World Lung Cancer Day is a time where we raise awareness of cancer and to encourage its prevention, detection, and treatment. And joining us now is Dr. Alozie from Sunset West Health. Wait, did I say that? Did I say that right?
Not
Sunset
really, but that's okay.
West Health.
At least you didn't mispronounce my name. So
I always
progress,
mess up
progress,
something.
progress.
Thanks for joining us, and we do
Thanks
want to
for
talk
having
about
me.
this important topic.
Absolutely.
So, to get started, just tell us what lung cancer is.
Well, so lung cancer is a malignant process that affects the lungs. There are adenocarcinomas, squamous cell carcinomas. There's a host of different types. I don't really like to get people all bogged down in the details, right? I'd like to make this a 10,000-foot view. I think the most important thing is it exists as a clinical condition. It kills a lot of people, and we can kind of go from there.
Okay, so talk to us about the survival rates and the top 5 killers, because that's important.
Yeah, so if you look at cancer across the board, right, it's lung cancer, colorectal, pancreatic, breast, and prostate. It's interesting that if you look at the differences, right, so the blue is what it had been in the 70s, the green or yellow, depending on how colorblind you are, is what it has been in the early 2010s. And you can see that the 5-year survival rate of lung cancer outside of pancreatic cancer is not that great. We do a really good job at breast and prostate and colorectal, not so much lung cancer.
Yeah, you don't really hear much about lung cancer. So with lung cancer being the leading cause of cancer death, why does it receive the least amount of federal funding?
Well, I think this is part of that conversation, right? We're not seeing those survival rates that you would expect, considering it's the #1 cancer killer. I think part of that is, and there's an emotional buy-in to breast cancer, right? We have the pink. There's an emotional buy-in to colorectal. People get colonoscopies, and we've talked about that before. But with lung cancer, there also comes a stigma because there is some socioeconomic and some societal blame on the person that gets lung cancer because they smoke, right? And so
Yeah.
because of that, there's not enough emotional impetus to drive the research that deserves to go into the #1 killer in cancer.
Okay, so talk to us about some of the lung cancer risk factors.
I mean, the honest truth is it's smoking, smoking, smoking. Yes, you can have a family history. Yes, you can have exposure to asbestos. If you have a house that has asbestos, get it taken care of. Don't buy houses that have asbestos. There are a whole host of historical things that happened in Detroit in the South where kids were put into homes that had asbestos and chemical pollution. Lead is one of them, and water and the paint. But all of those things, including arsenic, can lead to lung cancer. And of course, there's coal miners that get asbestosis and silicosis, and that can lead to lung cancer, and radiation therapy as well.
Well, what are some of the options for lung cancer screening?
You know, one of the things, again, if you smoke, try to stop. If you can't stop, try to reduce. Switch the types of smoking to non-smoke smoking if you have to. But I think once you've smoked a pack a day for 20 years, that's called a pack year, right? Then you should really be screened. If you're between 50 and 80 and you currently smoke, you should probably be screened as well. And it's an easy test. It's a CT scan. You go in, your doctor, your clinician will help you get it. It's about a 15 to 20 minute CT scan, and they can do a really thin slices of your lungs to pick up early cancer, and early detection is absolutely the key.
Okay, so where can we find some helpful resources?
Well, again, I think the first thing is, again, if you smoke, try to stop, right? If you are trying to quit, there are a host of primary care resources, whether it's a nicotine patch, nicotine gum, you can switch your brand. But whether it's EPPA or Rio Grande, there's a host of cancer centers. The cancer specialists do a great job, Texas Oncology, Desert Imaging. Think about it. One of the things that we didn't specifically talk about, if you start losing weight suddenly and you're a smoker, if you have a strange cough that changes color, texture, or the amount, anytime you cough up blood, that's an emergency sign and a conversation that you have to have with your clinician. Get screened and take care of your health.
Anything out of the ordinary.
Absolutely.
And if you have a question for Dr. Alozie, send us an email at news@kviu.com, and he just might answer your question live on ABC 7 at 4. I actually got a question, so we are going to address it next week.
Awesome. I'm excited.
Doc, thanks so much for
Thank you.
joining us.
Always a pleasure.
Let's get to storm track weather now. Doppler Dave's